preparing the live stream. Should ask you in a minute. That's it. We're going to be live streamed. I think we're going to be in any second now. Good, we're in. Oh, how exciting. Right. Maybe just bear me a second on there, get that there as well. Hi, Amber.
Hello.
Thank you. Yeah, thank you for joining us tonight. Really excited about this. So, hi, everybody. Just while we make sure that everybody can just start coming in, and I think it shows that we're live now, so that's really good. Big welcome. We're really lucky tonight to have the wonderful Dr. Amber Batson coming to have a chat with us. Many of us have been very much a fan, Amber, for a while, and the work you've been doing, and treading quite a new line, and a challenging line sometimes, which is bringing some of the more developed science now that we have around behavior and the kind of holistic element of that when we think about all the other elements that you bring in, neurology, physiology, and being able to make that accessible for the caregiver, for the professional, and for the trainer. And that's something that you've been doing, and it's been a big help to us as a community. So welcome along to the group tonight, Amber.
Thank you.
So we always like to start off this way, because I know from the feedback I get that people really like this. Tell us a little bit about yourself before we start, and how Amber ended up being Dr. Amber Batson, doing the stuff you do now, because I know it's quite an interesting story.
Well, maybe. Well, I was going to be a builder. I'm not going to go all the way back. When I was four, I wanted to be a builder, and yeah, that was important to me. But within a couple of years, I decided I might actually really want to be a vet, and yeah, and that's actually surprisingly what I ended up doing. I went to the Royal Vet College in London and graduated from there in 1999, which apparently isn't just 10 years ago. Apparently it's a little bit longer, but it doesn't feel like that. Yeah, and so kind of my I don't know, my journey, if that's really the phrase, in behaviour began, I suppose. And when I was at university, and things have changed now, we weren't taught really any behaviour at all. It was very, very uncommon, if not really kind of just, well, totally elusive for any amount of behaviour to be part of the vet curriculum. We talked about a couple of little things predominantly related to horses, how they had vices and bad behaviours that needed to be stopped, which of course now is kind of perceived in a very different way. And that was it really. And so, you know, I marched into my first job, which I started even before I'd graduated. I was so keen to get out there and get on. And so I started in June and graduated in July, which is a legal thing to do, don't panic. And I think in my first 6-12 months, I just really noticed that a lot of the consultations I was doing, and I was in what we don't see much of anymore. I worked in classic mixed practice. It was a practice I'd been with as a student as well a little bit. So I did cattle and horses and dogs and cats and rabbits, etc. All of them. And certainly from a dog and cat perspective, the thing that really bowled me over in the first year was how many consultations had a behaviour element. It was something I wasn't prepared for, because I'd had no education in this. And what I mean by that is some people actually asked about their behaviour, you know, of their dog or their cat. You know, my dog's barking a lot, or you know, my cat won't use their litter tray, that sort of thing. And what do I do about this behaviour? Of course, which I had no real answers to at all, and I didn't really have anywhere to point them either. And the other element was just sometimes people's observations about their pets was related to behaviour. I've brought my dog to see you because they're sleeping more. You know, I've brought my cat to see you because they're sleeping less, or they've become aggressive or irritable, all those sorts of things. And this fascinated me. I moved into my second job when I was about 2 years graduated, which was up in Surrey, and started to have a slightly stronger horsey feel to it, but again was still at that time a mixed job. And at that time, and this is when it really, really struck me, was that I was working a fair bit of my day with racehorses. And what I really noticed with the racehorses, which weren't really a kind of an area of equestrianism that I was that familiar with, what I really noticed was the number of immune-related problems they seemed to have. Now, they were flat racehorses predominantly, and flat racehorses are very young, and they might only be a year old when they start in training. They're certainly quite often only about 18 months when they're starting racing. And you know, so they're really young in themselves. Their immune system's not very well developed. But even the 3-year-olds, the 4-year-olds, and those that made it to 5 were struggling with recurrent infections or getting painful issues, particularly colic, digestive system problems. And that really set off these cogs whirring in my brain. And that was it then. It kind of just got whooshed along a journey. I was so desperate at the time to find out more about the science of behaviour. And I looked here, there, and everywhere. And at the time, so this would have been early, you know, noughties, so 2000, 2001, 2002, there was so little available. There was very limited university courses. I did a distance learning course with a university, which I look back on, and to be honest, was of really poor quality. But I didn't know at the time. Didn't feel quite right. It felt all muddled. It didn't really come out clear. And you know, but it was all that was really available. And then I met a lady called Heather Simpson, who had completed her master's in animal behaviour through Southampton University. It was a postgraduate master's course. It was predominantly attended by vets, and she was one of the first non-vets, as I understand it, to complete the course. And you know, and that really, my meeting with her really whirlwinded me on a journey of starting to look into the connections between the brain and the body and behaviour, what back then and sometimes we still call psychoneuroimmunology. And you know, as a vet, I found it fascinating, you know, that the environment that an animal found themselves in could impact that strongly on their health. And you know, that environment and that health could impact that strongly on behavior, but also that the behavior of the animal created the environment and could create health issues, which of course impacted on their health, their well-being, and their behavior. So you know, that was my stepping onto this kind of cobweb, I suppose, how I describe it, you know, with all these bits going off in all different directions. And ever since sort of 2002, 2003, I kind of got very embroiled in that science that was being produced at that time, and felt, as I loved it so much, I wanted to share it with people, you know. And initially, I'll be honest, when 2003, 2004, my vet colleagues took it really badly. I got shunned by a lot of friends, not friends with them anymore. People thought that I was talking weird stuff, and it was, I don't know, witchcraft or gobbledygook or whatever. And I'm like, and I felt so passionately about it because this was quality science being produced in journals like Psychoneuroimmunology journal by, you know, real top scientists, neuroscientists quite often. And I just felt, I don't understand why people aren't as interested in this as I am, you know. And so I kind of started to be an annoyance, I suppose. And I was just starting to, I'm going to keep banging on about this because I think it's so important. And I met more and more like-minded people along the way. And now I live in a community of people where I feel like everybody knows this stuff and I don't need to talk about it anymore. But here I am, surrounded by a community of people who obviously also find it so fascinating and know that there's so much that we still can learn and share to help us with our lives with animals.
So I think it's a really interesting journey that you went on there, because obviously you came into to be a vet, to do whatever vets think they're going to do when they become a vet. I'm not a vet. And then you went on this. What I think is interesting about this story is because quite often and maybe this is the case for you actually, quite often we find that individual who inspires us to think differently, who challenges us enough to makes us just look to the left or look to the right rather than what we were doing kind of heading on. And I guess the lady you were talking about there was that person. But what's interesting is a lot of this is your kind of gut feelings of, hang on, this doesn't seem right. There seems to be more that kind of separation that historically, especially in maybe the clinical side of things, is separation of behavior from the physiology or from the clinical, as though that it's somehow different and separate, not connected to. And do you think that, is there anything else for you that or anything that you can think of that was already making you think a bit differently? You know, any personal experiences with your own pets, for example, or what was it, do you think, that made you start to think and challenge some of that older doctrine?
Well, do you know, it's a great question, and I promise I'll keep it a bit shorter this time round. But probably the first time that I really noticed the connection, and this is probably a bit boring, but I used to help out and later on work a bit at a riding stables. And so I started doing that in my early teens, and I did it all the way through till my early 20s. I still used to go back there and help out and work there regularly when I was at university. And probably when I was in my sort of late teens, certainly before I went away to uni, one of the things that I'd noticed was that they predominantly, because we live where I was living at the time and where they were based, is a very clay, wet, horrible soil in the winter. It's very, very wet and boggy. And so keeping horses, particularly of any number of horses, out on that kind of soil type is incredibly tricky in the winter time. So all the horses would come in for the winter, and they'd be typically in 4 or 5 months in stables, individually housed. And that's just how it is in the equestrian world. But they didn't have enough stables for all of their horses. They, you know, as many collectors of animals find themselves in this situation, you know, got too many. And so there was always a small group of individuals, and they could be slightly different from year to year, that ended up living out in the fields, and the fields were wet and they were boggy. And one of the things I really noticed was that the horses who, when we came back from, you know, when they'd done their jobs for the day and they'd been ridden, they'd done their exercise and been out on the rides, and they came back and they had their legs cleaned off, and, you know, they were washed off and hosed, and they were put back in their, you know, lovely clean stables, compared to the horses who didn't have their legs washed off and got put back out into the muddy fields, because what's the point in washing them off? They're going back out into the mud. It was the horses who went straight back out into the mud who never got any skin disease on their legs. So there's this skin disease in horses called mud fever, and it's a nasty bacterial infection. It causes cracking of the skin. It's a bit like chapped lips, but imagine that all over your lower limbs and where your joints are, incredibly painful. And the horses that were stabled got that far more frequently. Well, in fact, the horses that lived out, certainly in that group of individuals, and it varied from year to year, never got it at all. And that's the turning point for my brain to go, what was going on here? And I guess that got reignited when I was considering the race horses. You know, when I was thinking about, you know, perhaps I was working with other areas of the sport and thinking, you know, well, actually, I've got other, you know, yearlings and 2-year-olds who live in different environments, and yet they're not getting all these immune problems and they're not getting all this colic. So what's the difference here? And I had an experience with one of my own dogs early on in my behaviour career. I'd been swept initially down that path because it was what was so available, into the dominance thing, you know, and I did some studies alongside some, you know, people who are quite well famous, you know, were well known for promoting dominance reduction at that time. We're talking, say, early noughties. And so I kind of did a number of behaviour consultations that were along that sort of line, the dominance reduction stuff. And I had a dog, a rescue dog that I took on, who had problems with separations and being fearful of a number of things. And I did dominance reduction with that dog. And one of the things that really struck me that I noticed about that dog was the more rigid I kind of became about the whole, I have to do everything before you, and, you know, you're not allowed to have that much choice, I have to dictate everything to you. He started to get more and more skin disease, and he'd come to me having had 4 or 5 homes at just over a year old, but in perfect health. Behaviourally, it was, you know, he was all over the place, but, you know, kind of skin wise and health wise, he was fine. But he started grooming his legs. He was obsessively licking his legs and giving himself skin infections on his front legs, and yet he wasn't doing that before that training. And that was my sort of last pivotal moment, really, where I started to really connect that and my previous horse experiences and go, there's a real connection here between stress and disease, you know, and the environment as well, and stress, or the environment and disease and behavior, which I need to know more about. And that's really what pushed me to go hunting and looking, you know, for kind of the science You know, I'm a real scientist at my core, it would seem. And whilst I love to practically apply stuff and get out and be dirty and just, you know, get on, you know, with my practical elements, I do have to kind of stop and go, but, you know, am I sure about this? What do I know? What's my knowledge base before I make that? And that's a bit of a funny thing in our household, because my husband is a very different personality type, you know, and my husband will just have a go at something and see how it pans out. You know, whereas I'm always the one going, no, stop, we can't possibly do that because we haven't made a plan, you know, we haven't assimilated all the information. And, you know, so, and we'll often butt heads over that kind of thing. So
very similar to my relationship, actually. I think the reason it works is because if it was down to me, nothing would ever get done. If it was down to Kieran, everything could be done 5 times. So between the two of us, we get a nice pace, you know, which is fair enough. I think that's really interesting as well, because it's interesting when we think about science and the application of it and the narratives that some people can make from that. You know, a lot of our colleagues in my community, in the dog training community, dog training and behavior community, rely upon others to pass on that information, because we're not necessarily academically minded enough to dive into papers or to look at the various things. And I think this is what's frustrating for many who have followed a very heavy training or operant model for a long time, because that's how it was pitched. And especially our colleagues, I had a lady who contacted me recently who heard me at a talk I gave for an American-based organization. And she felt that, you know, she'd felt uncomfortable with the dominance hierarchy model, but it kept being pitched to her as being so supported. And I think it's hard to navigate through with this stuff. We were talking off air about how we have to be careful of absolutism on any end of the spectrum, really, and just to try and find enough information to help us be the best practitioners or caregivers we can be. And this is definitely a shift, I think, from a more task-orientated view of behavior, which is we need to change behaviors, to more of that care-orientated approach, which is thinking about what's underlying with these things and trying to join the dots. And I know with a lot of the education you do, and you obviously your dog aggression courses are extremely popular because it unpacks a lot of that, doesn't it? It takes away the notion of just arbitrary labels and trying to shift behaviors, and think about the many elements, it's multifactorial, that go into a presentation, and really focuses on the dog's behavior as an expression of self, as an expression of need, as an expression of current state. How do you, what's your main kind of objective when you start unpacking that, especially when you're trying to get a trainer or professional audience to buy into what you're doing? What's your kind of mindset going into that? Because I know, speaking to people like Kathy Murphy and others, when they took a little detour into the dog training world, suddenly it's like, oh, bloody hell, there's a lot of stuff going on here and it's pretty full on at times. So there must be some trepidation sometimes about navigating some of this.
There is, and there've been, if I'm honest, there's certain cultures, and some of that is kind of geographical cultures, but then there's cultures within geographical areas as well. Kind of, you know, I'm not going to give them any labels, but they may have labeled themselves as a certain type of trainer or a certain type of approach, and they've created their own culture. And of course, it happens in animal training, doesn't it? And it happens in hairdressing, and it happens, you mentioned fashion to me off air earlier, it happens in all of these different walks of life. And yeah, and I think it's interesting actually, because my aggression course, we're going to be relaunching it in China next year as well, interpreted into Chinese. I've taught it in Asia before in person in those good old days, and I was supposed to be going to China actually the March that we all shut down. And so my host for that and I have worked together with interpreting my new online version so that it will be interpreted in Chinese. And it's quite interesting because she sent me some questions for the marketing, because it's a very, very different market, you know, and she's predominantly aiming it at China. I mean, it could be for anybody who, you know, can speak Chinese Mandarin, because that's what it'll be in. So it doesn't have to be China specifically. But it's, I was actually writing some things for her this morning, doing some little mini articles for her to then interpret or translate and then use in her marketing. And some of the questions she was asking, you know, the approach very much is in the culture of the individuals that she's kind of targeting is a very heavy training bias still at the moment. And so, you know, one of the questions, you know, that's in there is, well, one, why is this course different, you know, and secondly, why does it matter? You know, why can't we just train the dog, in effect? That's sort of one of her questions, because it's what everyone's asking. Well, how can we just be better trainers? And so, you know, it really, for me, is about trying to just stop for ourselves and think about, we can just stop and think about ourselves and our own behaviors that we offer. And whether when I say we offer them, whether sometimes it's totally voluntary, you know, we're consciously fully aware of what we're about to do. And sometimes it's that kind of grey mix that actually maybe you started to do something without really having thought it through. There was very limited conscious input. And then maybe you become kind of more conscious as you're actually kind of carrying out the action. And so then you may or may not modify it. You might just roll with it, or you might just stop and decide to inhibit what you were going to do and change it and offer something different. And when if we just think about ourselves, we know that the stress and the environment and how we're feeling and all those sorts of, like you call yourself, how that impacts on how you're going to be that day. You know, if I haven't slept very well, you know, and that happens quite frequently these days for reasons I won't go into, but if I haven't slept very well, I may have sometimes a very different outlook on that day compared to if I'd slept really well, you know. And if I've skipped breakfast and I'm hungry, or if I just happen to be hungry, even though I've had breakfast today, you know, if I'm hungrier, if I'm more tired, if I'm not feeling very well, if I'm in pain somewhere in my body, or I'm feeling a bit nauseous, we all know those things change the way that we might respond to situations we find ourselves in on that day. And I think if we can always have that in mind. Of course, the question that historically used to get asked, well, you know, do animals have that concept of self, and, you know, how aware are they? But it's happening at a physiological level. It's happening at an internal level. You know, so much science about, as an example, what happens when, you know, your sugar levels within your tissues, not necessarily in your bloodstream, are lowered, or when you have pain in your body, or when your gut bugs change in the balance that they are. You know, so much data these days available in animals. And the majority of it's done in animal models, laboratory animals, you know, like rodents initially, and then perhaps expanded into the, you know, the poor rodents, I will say that, and the poor dogs and the poor cats and the poor primates, you know, and that are being used for that kind of stuff. And then we extrapolate that to mean the same for humans. But actually, for a long time, what we've not been very good at is then extrapolating that and go, well, do you know what? If that happened in the rodent and the dog and the primate, maybe it's applicable to the rodent and the dog and the primate. If we know that sugar levels kind of changing, fluctuating, if we know that sleep fragmentation, deprivation, if we know that pain, you know, all those things, if they can change our physiology, what's going on inside our body and brain, to a level that can change our risk assessments, our motivating drivers, then that's going to be relevant for animals as well. How much they're consciously aware of it perhaps doesn't matter so much. You know, I don't know, Andrew, that you're really a conscious being either, because we can't put a finger on it, can we? No, I can't feel that you are.
That's a really good point, because it's something that I discuss myself, looking on the psychology side of things, about the notion of the emotional experience and how abstract that is, and how you and I, the same species, will have a different experience of what that neurological and physiological responses is like. And I think that's the kind of get out of dodge card for us regarding, well, we don't know how the dog feels. Well, do we have to? No. Or can we just try and be available to what that emotional truth might be for that dog, and recognize that, for me, the word I use a lot is the word relief, because I think, you know, when we start to have that mix of things that goes on for us, we are seeking relief for a lot of things. And the big question for me is, from a training point of view, are we offering relief to that animal by arbitrarily getting them to do something because we can through training? And I think that is the big discussion that's going on in the moment, because we felt quite secure in our training model before, because a lot of the science, especially the science in dog training, has been about the reduction or support of behaviors through variant operant models, without thinking about the authentic model of behavior for the individual animal. And I think that's a big thing to start considering. We talked about off air about a realization for us on the more progressive side of the fence regarding the methods we might use, that actually we have to be mindful that some of the things we might do through positive reinforcement might be equally coercive and damaging. And that's a big thing to take a breath and think about. And it is an invitation to think about that. It's not necessarily saying we're going to stop all this stuff, but it's just thinking about it. And it's important, isn't it?
It is. And, you know, I would give an awful lot of credit to a lady called Catherine Bell. She is a co-founder, I don't know if that's quite the phrase, but she's certainly on the committee of Equine Behaviour Training Association. And she gave a short presentation at a conference I was speaking at many years ago now, probably. Time flies, doesn't it? So it might have been 10, maybe 12 years ago, where she was talking about autonomy, you know, an agency. And she kind of had this continuum where she said, you know, well, actually, truly, kind of when we think about behavior, at one end of it, we've got kind of punishers and reinforcers, and we might want to put positive reinforcement kind of further along the line of what's good, you know, but actually beyond that line extends, you know, if we think, you know, and actually what is beyond that line is this huge kind of thought about autonomy. And actually, just because you can teach and she said, just because you can teach an animal to do something for positive reinforcement, what has that done for that animal's kind of self-ability, self-regulation, self-control, their welfare, their well-being, etc. And that really, I was sort of already there, and, you know, and that was already part of what I was doing at the time, you know, kind of choice and, you know, environmental management, and not really focused on operant or, you know, kind of associative orientated training techniques. But it just really hit the nail on the head for me and made me go away and think about that much more, in a much stronger way, I suppose. And I mentioned to you, didn't I had someone around about the same time, it must have been when I was teaching in Poland, and said, you know, asked a question from the audience and said, are there any negatives to positive reinforcement? And at the time, I was so shocked by that question in a way, because I just wasn't prepared for it, that I went, no, I don't think so. But I would answer that question very differently today. And in fact, I just have, because one of the questions or kind of mini articles I've typed out this morning for the Chinese market was in relation to, is it a good idea to feed a dog who's shown aggression from your hand? You know, and it was following on from a question about why might a dog wag their tail and take a treat from you, but then as you go to move away, bite you? That was the specific question they'd asked. And, you know, so I was very much exploring this idea that, you know, you can, in some circumstances, you know, have a wonderful carrot if you're the horse, or a wonderful piece of cheese or hot dog sausage if you're the dog. And there's like this risk assessment in the animal's brain that they might not even be consciously aware of, potentially, that's driving them to kind of make a decision about taking that piece of food and bringing themselves into proximity of a human who, you know, perhaps they're actually fearful of. And as a vet, you see, I deal with that every day, don't I? You know, and, you know, I'm forcing animals to be in my proximity who I can tell you probably 95, 98% of them do not want to be in my proximity, you know, and I know it's for their good. You know, I'm trying to make you better, you know, or I'm trying to prevent you from getting sick, but they don't understand that. And I will, you know, I can have a piece of food, and I don't do it very much now. I don't lure them into my space, but equally I've got to work with them, you know, and if I'm going to do it, I tend to put food on the floor so that they can make some more choices, rather than have it in my hand and go, you can only have this if you come to me and touch me. It's tricky, you know, when you're you know, that kind of professional, because you do have a job that needs to be done, and it needs to be done with some urgency, of course, when animals are unwell as well. But it's, to think that positive reinforcement doesn't have any limitations, you know, was a huge blind spot for me for a long time. And, you know, and that doesn't mean to say I've ditched it, doesn't mean to say I don't use rewards, you know, and don't use operant conditioning or associative learning in what I do or what I teach. Of course I do, because it's always perhaps going to be an inherent part of our relationships, but it's certainly only a piece of the puzzle, not the whole thing.
Yeah, I think a tool in the toolkit, not the toolkit. I think that's something that we think. I think that's you've described something really well there about because we don't know what the dog's internal value is to things until we work out that more for us about what's happening. We can create a lot of conflict through like a primary reinforcer like food. You know, we can force through food. We have to remember that, you know, and like you say, if you've got a dog, the example you gave is a really good one of, I need more time to threat evaluate this social engagement here, and I'd ideally like more space, but I really want the food, so I'm going to come in. To think that we're somehow always going to be counter conditioning something else. Again, even with counter conditioning, we have to step back and think, what do we think we're countering for a start off, and what do we think we're putting in its place? And this is where, so even just basing that on our observations can be tricky to ascertain that sometimes. I was working in a rescue a little while ago, not the one I'm with now, previously, where there was quite a nasty bite because they'd seen the dog have what they perceived was a really friendly response when they'd walked into the kennel. So they went to pet the dog and the dog bit them really badly, but they walked in with a tug toy and the dog's response was to the tug toy, not to them. They just happened to be holding it, if that makes sense. So I think this is what we have to really reconsider and step back and realize that it's perhaps a little bit more nuanced and definitely more complex than just the arbitrary changing of a behavior, because we can.
And I think that is part of the problem though, isn't it? And it's certainly places where I go at times and just think, oh, you know, it's too complicated. And what we want, for most of us, what we want is a simple answer, you know, and we're all like that, you know, no matter who it is, we'd like this to be simpler. We'd like our lives to be simpler. We'd like our relationship with animals to be simpler. We'd like our training and their behavior to be simpler. Wouldn't that make life easier and nicer and more enjoyable? Would it? I don't know. I think it'd probably get quite boring, to be honest, for most of us, but it's just not how it is. And I think it is difficult though sometimes to kind of, we can hugely kind of grossly oversimplify, but equally we can try to make sense of things that are far too complicated, and sometimes we've just got to accept it's too, you know, the brain in particular, the brain and the body is just, it's too complicated that we will never ever be able to get a total handle on that. So where do we feel comfortable ourselves with kind of our level of knowledge and acknowledgement to be able to apply in a certain situation? And it's a tricky one, you know.
It is a tricky one, but
I'd like it easier.
And I think some of the really important words, I've just scribbled down some of the words you said there, because I think these are really important words that help us here. Acceptance, I think, is a really big one. I think the part of my job is, I call it supported awareness. It's allowing the caregiver to have a supported process where they can start to see their dog's real care and support needs. And this is the other word you mentioned there, was truthful. Being more truthful. I think we have to be more truthful about things for the caregiver so that they can think about those expectations that come, because invariably when they employ us, they have that task orientated view, don't they? Because they're like, I'm employing you because I want my dog to stop this or not do that or not bite me or whatever it is. And it is a process of building these things through. And just for anybody listening who just works with animals, you know, in my days working in human therapy, it wasn't any easier, I have to say. It might have been harder, actually, because humans, we are notoriously rubbish at communicating emotional need. So it can take a long to try and pull out some of the things just from a psychological point of view, let alone the elements that is going. And even in the human world is still very disjointed, isn't it? You know, emotional, mental health is too detached from the physical health side of stuff from a therapy point of view, and it should be more connected. But I think with animals, the key really, and I think this is something that we've discussed before when we've spoken before, is allowing us all just to slow down a little bit. I think when we go down a training route, sometimes it's the opposite, because we're looking to do things quicker and get things faster. But giving ourselves a chance to step back and slow things down is a good place to start, right?
Yeah, well, and certainly it's taking a breath, isn't it? And it's being able to be in that moment and be able to be aware and to be able to observe and to feel, you know, and that's such a big thing, isn't it? It's to just be able to just stop, but then be actually present on many different levels, and to be able to then consider, you know, because you can't consider when you're when you're not taking that breath, when you're rushing, etc. And we all do it. We always rush around. And I had an encounter with my little boy. I have a 5-year-old son, and I had a little encounter with him yesterday morning over something ridiculous to do with his advent calendar. And in that moment, I lost my ability to stop and take a breath and really feel and observe. And so we all do it, but the more we practice it, the better we get at it. But it's such a valuable place to be, because unless we can stop and observe and feel, then then we're not really going to get any kind of any sense of what we might be able to change, and if we need to change it. It's another thing, isn't it? It's so often we do focus on there. And I can think of some recent scenarios as an example that I've had with clinical cases, very recent cases, where I just want them to stop barking. And actually, I could think about that myself with my own dogs. I have one dog who's incredibly quiet, to be fair, but the other one's a terrier, and he would bark more at our neighbour's dog, as an example. And actually, I'd just like you to stop. But then, actually, why do I? Is it just me? Like, why do you need to stop? Why do I want you to stop, and what value does that have? And maybe it doesn't change. Maybe taking a breath and stopping and observing and feeling doesn't actually change the outcome, but it could have done. And unless we give it a go, we don't know, do we? That's part of the problem.
And I think something you touched on earlier about how I love that word, being present. I love that, because I think that's what we're trying to be. And people have heard me talk before about trying to be available to the truth of another, in this case, another species. But the more elevated we are, the less available we can be. And it's just, this is something that we know that we can make assumptions of about our dogs. The more elevated they are, the less available, the less they can be able to process properly and be able to kind of, be available to those kind of things. And I think I love how you frame that as well about, do we need to change some of these things? And actually the things we're looking at changing, is that just another symptom of a bigger underlying thing, something that's, where we're seeking the primary, and that just turns out to be a secondary. Yeah. And a lot of these nuances we can miss if we just go in and think, we're going to train the dog to do something else because we find it more appropriate, especially some of the differential reinforcements of incompatible behaviors, that's a mouthful, but the mutually exclusive behaviors side of things, I think we have to be really cautious there about what we're replacing one behavior with for another, and is that animal getting the relief they might have been getting? Actually, a lot of these behaviors, there may well be a relief element for the animal from those behaviors.
Well, yeah, and I think it's one of the reasons why I'm so grateful for my multi-species background, because on the equine side, that's where I really saw that initially. Where we say to the horse, no, you're not allowed to do that particular activity. So as an example, we'll go back to my university days, and what were called vices, these illegal, immoral behaviors that horses have, where they basically are doing some not normal for the species, repetitive, what perhaps might appear to be compulsive behaviors, like weaving, like rocking from side to side to side. And in the equine world, and it's still quite common today, but perhaps slightly less common than it used to be, then we just try and stop that behavior. We don't like it, so we're going to stop it. And the way we're going to stop it is we're going to put up some metal bars on the front of the door, so that when they put their head over the door, which is of course where they want to be, because that's where all their mates are, because inside it's just a dark box, they can't do it anymore because they've got metal either side. Or someone I used to work with used to hang big bricks down from the top. So if the horse did it, they got clouted by a brick. It's all about stop the behavior. And the thing that I got the opportunity so many times to observe was it came out somewhere else. Those were the horses that got more colic. Those were the horses that got more infectious diseases. Those were the horses that seemed to have more immune related problems. And often they'd have perhaps more aggression towards people. But if I think about racehorses in particular, the horses that were wearing some sort of equipment to stop them offering behaviours were the ones we had to be super careful around handling, because they were so explosive, they were just dangerous. And that led me on a path of acquiring a whole bunch of animals over a long period of time that had gone through that suppression orientated training of, or suppression of something within their environment. Both horses and dogs, and seeing kind of, you know, where they are now health wise, and then just removing those restrictions and allowing them to get back into a more normal balance, you know, being able to express themselves, make choices, etc. And seeing what that did for their health, and then ultimately what that did for their behavior. And it was just invaluable. And so I'm kind of, you know, it's so sad that I have seen so many horses in that way, you know, literally probably hundreds, if not more. But at the same time, that has been a huge driving force for everything that I advocate today. And, you know, so we're ever in debt to those long-suffering individuals.
And I think, you know, I've got friends, probably mutual friends actually, who are involved in the equine world, which is just as complex and fractured and fractious as the dog world. I think it's a very, you know, who are really trying to get more awareness. We were discussing this off air. You know, it's not about people being deliberately, you know, cruel or horrible or whatever. It's just lack of awareness. And I think the more aware we can be, that's why I use that phrase, supported awareness. And there's a saying in human psychology, which is emotions will find a way out. And I think that's what you're describing there with the horse. That relief wasn't coming, so it has to manifest somehow, those kind of those emotional needs. And I think it's interesting that a lot of my either clients or colleagues who have come from either a trauma-informed place or have experienced trauma themselves, or our friends in the neurodivergent community, people basically who have had external pressure put on their square peg to fit a round hole behaviorally, and they know the added trauma that comes with that. And it's not a big leap to think about that with animals, and to think about a lot of the successes that we can get. You described just some of the cases yourself there, and I found it with dogs. Actually, it's listening more and doing less can give the bigger results. Allowing more freedom, more chance for that relief, more chance for decompression for the animal, and for them to be able to self-regulate rather than as micromanage and end up having to do that for a long time.
Yeah, exactly. And, you know, and we do understand, you know, a lot of science behind all of that too, you know, and as well, there'll always be elements that we can't scientifically analyze, because the whole emotion thing, and, you know, we do understand elements of that scientifically, but we'll never understand it enough. And so for me, it's finding that balance between kind of, you know, knowing what we do actually know and being able to use that, you know, but equally being able to go, well, we don't know everything, and actually there's not always an exact answer. Let's just take a breath and observe and respond, but doing it in an empathetic kind of aware manner, you know, and awareness means that you're going to have some baseline to work from. And I think you know, our baselines are always changing, aren't they? All of us, you know, you've been there, I've been there, we've all been there. What I would have thought, you know, I would have thought maybe 10 years ago, 15 years ago, maybe even 5 years ago, that I knew quite a lot. And, you know, and every day we learn more. It's that, you know, Dunning curve, isn't it? You realize you know less and less and less. And, you know, it's a tricky thing for us, because we don't like feeling that we don't know, and we think that actually, you know, we're okay where we are, but that can be very, very limiting sometimes. But equally, we're sometimes in those places for good reason, you know. Maybe it's not necessarily okay to be stuck and never question, you know, and be that rigid. That's probably not really okay for most of us, but it might be okay at a time when you need that, you know. And that's the important thing. You know, I've seen lots and lots of people over the last, say, 20 years take different paths at different paces, and perhaps end up in very, very similar kind of, you know, places. I wanted to say that, but it rhymes too much. It sounded too poetical. But, you know, that is that people's different kind of paths, isn't it? And how they may be. And it's just such an important thing to be able to just stop and ask ourselves, are we okay with this? Are we blinkered, or have we removed those blinkers enough, you know, for a period of time? And how are we okay? Are we okay with that ourselves? And how are we going to manage that?
And I think that's a really important part of this, because I know with the Beyond the Operant series, which you're going to come and join us in the new year, which is going to be really excited, because that's going to be a geek fest with you and Kim and Kathy for sure.
One of us is going to have to be gagged on a regular basis, or no one's getting any words in.
We might have to make it an extended edition, maybe. I think that'd be good. It is, I find myself saying this a lot because it's quite defensive, I know, they said, because of some of the criticisms we get along the way, but it is beyond the operant, it's not instead of. And I think I invite everybody to think about things, especially some people have very strong views on things, so it kind of becomes a bit absolutist. You should never do this, you should never do that, and that's fair enough. And I think we need those kind of voices to make us all question a bit. But it's a case of us trying to find a way of listening and being challenged a little bit, but not threatened by it enough, and to find our own way through. And this is really important. All these discussions, people can find their own threads about what they feel comfortable with. And as you say, we get on a route. I find when we do start to question the arbitrary control and coercion of behavior and start thinking about the uniqueness of self, which, as you know, is an abstract thing. It's a lot easier for me, Amber, because I take a philosophical view to stuff. That's my get out, you see. When you start doing that, you don't have to worry about necessarily waiting for the science. You can just think a philosophical discussion about the abstract nature of self, because it is abstract by its very nature. But it does send you down a path then, which you alluded to it then. I think when you go down that, you are equally excited and enthralled and also overwhelmed at the same time. It's a little cycle of both, isn't it? Because it's a lot, really. And we're all on that journey of even working our own self out, let alone trying to work out another.
Yeah, and that's the thing, isn't it? When we are faced with this with our children or our parents or our partners or other human beings that are part of our lives, and we know how difficult it is even to kind of be aware of ourselves and kind of be true to ourselves, and and be fair to those around us, not put others under too much pressure or threat, or and whilst keeping ourselves safe and others around us safe physically and emotionally. And then we add animals into the equation, and actually the majority of people don't have enough education to understand exactly perhaps what an animal is trying to communicate. This becomes a bit of a minefield, doesn't it? And we are trying to find our way through that minefield. All of us are.
And it takes multidisciplines and many voices. I think, as a community in my side of things, it has been easier to capture a certain thing and make it your own, and have certain camps doing various things. Because when you start thinking about just that arbitrary change of behavior, you can have 101 ways to do it, 101 tools to do it, and all the discussions that go on with it. These discussions that are happening now, we need a bit of multiple disciplines. We need the ethologists, we need the psychology, we need the kind of neuroscience. We need to have all these different component parts to give us a bit of an insight, to give us an idea that behavior is actually quite complicated. And I think most of us anyway, are already indoctrinated into a good to bad continuum of behavior, which is supported by reward and punishment. Our whole education system, our judicial system, our societal system. So it's a lot to break free from when we're going to step back and be a little bit more nuanced about seeing behavior as that communication of need, communication of self.
And it feels, I guess, it feels incredibly uncomfortable, doesn't it? Particularly when it's been conditioned, indoctrinated into us from the beginning, and absolutely nobody wants to be suggesting that it's so. It would be a bit like somebody would say, "Oh, so you just think it's okay for the dog to bite people then?" Well, no, of course I don't think it's okay for the dog to bite people, but we do have to take a step back and think about what is causing that bite, because actually, if we can change what causes it, then we change the behavior in a way that hopefully addresses, kind of the need of that animal, and gets kind of a behavioral output change that is desirable for all of those around that animal. And that's a win-win situation.
Yeah.
And if we only focus on the output, then we're at greater risk of that individual expressing themselves in another unacceptable way. From a welfare perspective, we're in a risky situation where maybe we're actually compromising the health potentially of that individual through the stress of having to suppress that particular need or not having that need met. And we're always at risk, of course, of what we call in the training world spontaneous recovery.
Yeah.
You know, because that motivating you know, kind of drive is still there inside that animal. We've done nothing to change that. When it comes out hard and fast, and that the last bite's going to be the biggest and the hard, you know, and the hardest and the most damaging, and that's really super risky, you know. And I've been there and worked with animals from that perspective a long time ago, and I work with that in veterinary clinics on a regular basis, and I suppose that what makes me super aware of that, you know, and not really how I feel for me is the only way to address it. And that doesn't mean to say I might not train an animal to offer something different in certain contexts, in certain situations, but I'd still be thinking, this is just a kind of using polyfiller, you know, over the hole in the wall still. You know, I'm going to have to take the tiles off. I'm going to have to look underneath to see what the damage is structurally to properly fix those cracks, you know, and that's, you know, but it is scary. If I was to take some of the tiles off my walls at home to expose what's underneath, I know that would be a scary thing to do. So, you know, it is a big kind of decision, and it's a big process for us all to go through.
You're getting a really good example there of the risks that are there when we have a heavy training model, because you described there about spontaneous recovery and how some views of, especially with a very heavy training bias looking at that somehow the rates of reinforcement weren't kept up, or that the you know, whatever it was, and that's why you end up with the spontaneous recovery, rather than recognizing that the spring you've been pushing down on actually sprung through now. And it's just having that different perspective, isn't it? And I think this is that thing about being truthful again. I think I worked with a dog going back a couple of years that used to lunge and growl at children, and they got a trainer in, and after a few sessions the behavior stopped. So the owners were very pleased with that, and they left good reviews for that person. And it was about 8 months before the dog bit a child, and then I get called in because there's a destruction order and everything else. But of course the issue hadn't been resolved for the dog. They just managed to sort the behavioral output out, and that dog had never shown any signs of wanting to bite before. You know, with Rotties especially, it takes a lot for them to actually, they like to give a lot of bluster and a lot of kind of warning-y stuff, and that's a good example of that dog just having to have that internal suppression until one day I've got to express myself. And I take the view of behavior being the behavior we do ourselves, and understanding the complexities of why we do stuff, the motivations that we have. Some of them we know of, sometimes we don't, right? We just do stuff. But also the behavior we judge in others, and we are judgmental. We all love to judge, and we all hate to be judged. It's just a human thing. And I think this is some of the old models, especially the dominance model, right? The reason it's so alluring, and most people listening to this now won't subscribe to that anymore, but it is still the zeitgeist. It's still the norm in both of our professions. There's still many people who believe on that side of things, and especially with the general public. But it's alluring, right, Amber, because it fits this notion of behavior bad, need to change it. If I'm the boss, I've got control, therefore they'll do as they're told, and everything will be all right. Yeah. So there's a lot of perceived wisdoms that we're challenging here along this process, and it can be a bit scary and a little bit painful along the way. I know it has been for me over the years. It takes a lot of cognitive reappraisal, as our friend Laura Donaldson talks a lot about. But it's the same for us, right?
Yeah, absolutely. Of course it is. And you know, and that's like you mentioned earlier, you know, about the indoctrination within kind of human society, but that's how we see it, and we talk about it with our children, you know. And having my son really open my eyes to that. My son, I think, was only 3 weeks old, maybe not even that, 2 weeks old, when I was walking my dogs one day through a village that's local to us, and he was asleep in a sling on me, because I've got the two dogs, and you know, they were on a road, so they were both on long lines, so I've got my hands, and my child's here, little tiny baby, and somebody stopped me and said, is he a good little baby? And he's 2-3 weeks old, and it's already begun. Is he good? You know, and I have to admit, in my probably relatively sleep deprived, post cesarean, moderately still painful state, I wasn't perhaps as good as I could have been about the appropriate answer, but because I actually said, well, he hasn't done any shoplifting yet, if that's what you mean. And of course they were a bit like, oh. But I just thought it's just such a weird phrase to use, isn't it? And what you mean is what you mean, does he sleep at night? Does that make him good? And it's been a huge journey for me, being part of, you know, all over the world, this kind of, again, almost an awakening, really, perhaps, and maybe that's not appropriate, because culturally it varies so much, but certainly in Western culture, this concept that, you know, we're starting to label and judge from such an early age, and the things that we judge on, like, can you perform in a specific way? Can you sit still for a certain length of time? Do you sleep well? Do you shut up when I need you to shut up? You know, it's fascinating, really, to watch that, and then how that impacts on kind of how we then might perceive our relationships with animals, you know, and that makes it really, really hard for all of us, because we're always trying to kind of unravel what's been packed into us and in effect forced upon us within our societies for such a long time, all our lives.
And I think this is a big thing. Sindor, in the chat that I had with Sindor, I think it was last weekend or the weekend before, she was talking about how when she started to connect to her dog, because we all have those experiences that make us think a bit differently and recognize our own judgments and our own biases, how it changed her outlook and how she had to reappraise a lot of things about herself. And I think we do, when we start thinking and talking in these terms, and we start thinking about our relationship and the power dynamic, if you like, with our pets, with our partners, with our children, the expectations, the conformality that we expect through behavior, even though it doesn't have perhaps any internal value to the individual, it poses more questions than it asks. But it shouldn't stop us from opening up our horizons this way, because from a very practical point of view, it gets us best outcomes when working with our dogs, actually, ultimately, because like you're saying, you know, it's far better to get a dog and address their pain, address their physiology, because we've identified those aspects. We've addressed their emotional needs. We've got them so they don't need to have to feel they have to communicate in such a way to get the space they need or the time that they need. And most importantly, something we keep talking about in this talk tonight is getting them to self-regulate better. So rather than giving tools to the caregiver for them to be able to control their dog, the dog's able to control themselves better. And I think that's the ultimate thing to think about, isn't it? Yeah. We're coming out of time. It's been amazingly quick. What I wanted to try and do tonight, we have, is to get a chance to have quite a kind of a casual chat, really, about some of this stuff. And because of your position and what you do, both with your professional title and the science that you bring, to really support a lot of people in the group who are starting to think about things differently and know that it's not just, you know, woo-woo, as Hannah Capon says to me sometimes, that it's very supportive, actually, that we can start thinking in these terms and recognizing that we do have enough information on the neurology and physiology and the processing aspect of these things to start taking some of these extra considerations into account. People need to think about deep diving with you, Amber. I think this is the thing. And so could you just tell us a little bit about what's coming up and how people can get the more academic-y side of what you do so they can learn some more about this stuff in a more of a deep divey way, really, the courses that you do and the events that are coming up and how they can find out more about you professionally?
Yeah, thank you. Well, my business page on Facebook is the best place to go. So it's Understand Animals as my title on this video now. You should find it. It's got an image of a very handsome black bull terrier on a wall and some horses, so you'll know it's that multi-species thing. And you know, I'm actually due in the next week or so to put an updated list on there of kind of things that are going to happen in the next 6 to 8 months at beginning of 2022. But yeah, I mean, there's a variety of ways, and I'm just about to launch into what we're calling some behaviour mini bites. They're going to be 20-minute free sessions, 10 minutes on dogs, 10 minutes on cats, that are going to be aimed predominantly at the caregiver rather than the academic. So that, because I do feel a little bit I've been dragged more and more into educating the professionals than where I started, which was trying to educate caregivers. And so I'm hoping next year to get a better balance of those two
Brilliant.
things realistically. But there'll be plenty of more academic-y things. I'm speaking for the APBC next year again. I've got lots of things lined up with various communities and charities and welfare organisations, as well as my aggression course restarting and all those sorts of things. So yeah, you'll find all that information on my business page.
That's brilliant. And just to kind of finish off then, two questions really. First of all, do you feel that there is a change happening at the moment regarding our outlook within the profession more so? Obviously, hopefully that'll have a trickle-on effect down to the general public. But do you feel there is a change regarding our outlook on behaviour? And secondly, do you think, so that's within the more wider kind of professional community, and secondly, do you think that there has been a shift in the education of behaviour within veterinary science? Two questions.
I'll do the second one first, actually. There has been, there's no doubt there has been a change in the education of vet students going through the courses. We've got more vet schools than ever now, you know, so and there's new collaboration happening between London, the Royal Vet College, and Aberystwyth as well, which is new, and Nottingham, of course, and Surrey, you know, and Harper Adams. So new vet schools, and the curriculum has changed. I mean, the focus, of course, still is always going to remain on disease, because that's really what we perceive vets to be, just like we perceive GPs to be there, you know, for that. But we are starting to appreciate that, you know, it's that physical health relies on emotional health, and they're not separable. You know, and when I speak to most vets nowadays about that, I don't get the same look that I used to get. You know, I think everyone's more aware of it, even if we don't perhaps appreciate the depth of science that there really is behind it. So it is there, but ultimately, you know, there's a time limit on how much you can pack into 5 years of veterinary education. It's a full-on course as it is. And so to really fit in a lot more on the behaviour, psychoneuroimmunology side, it's always going to be a huge challenge, but it's definitely hugely improved than it's ever been. But it's a step, you know, and we've got to keep climbing up. Do I think there's been a change in our kind of community, our more behaviour professional community? Yeah, I do. And, you know, so much so that I know when I spoke to you not that long ago, I said to you, well, I mean, sometimes I almost feel that I can hang up my hat on the dog side, because I don't feel that I need to be banging on about so many of the things that I feel I've banged on about for so long. Sleep is such a good thing. You know, I mean, I've taught about sleep and lectured about it and banged on about it for, you know, probably the last 15-18 years, and nowadays I don't feel like I need to so much, because people go, oh yeah, you know, sleep, if you don't get enough sleep, you know, you don't feel great, you know, and emotionally it impacts on you and you don't learn as well. And I'm like, brilliant. So, you know, I do feel there has been change, but you can, as you said, get caught up within bubbles as well. It's easy to get caught up, and I think certain social media platforms, you know, they very much kind of maximize your bubble, because you only get the feed that kind of you want to see. So of course you might not be seeing outside your area. But I do feel that, you know, when I try to move outside my area and I try to kind of, you know, investigate into other communities and etc., that actually change has been afoot in those places too. And I've just been really overwhelmed in the last few weeks joining. I've kind of shied away a little bit from equine welfare, horse welfare, for a little bit, because I needed a break. I felt like I've been banging my head for too long, and I wasn't getting anywhere. And then literally in the last few weeks, I've joined some amazing online kind of get-togethers with huge national organizations. And I'm feeling really empowered about that now, because we are really coming together and improving that now. We've come such a long way. Just I gave a presentation 4 years ago at the National Equine Welfare Council, and felt that I hit a lot of nerves, and there was a lot of agitation about some of the things I said. Whereas I gave a presentation 2 weeks ago, and I felt like it was received by a whole different audience, and yet the audience members were predominantly the same. So for me, that's a measure of how much change has been afoot. and I think it's wonderful, and we've got a long way to go, and there's still so much we can all learn from one another, but yeah, I think, you know, and perhaps social media and the internet has played a big role in that, because we can share things that we never used to be able to share. But yeah, I think also just it's that whole kind of expansion, isn't it, of the collective consciousness. It's rolling out there, it's getting there, and it's motivating change, and that's exciting and wonderful. And you know, and what you're doing in particular, and in your community, all the people who are listening or may listen, you know, are all a huge part of that. We're all part of that, and it's fantastic.
Oh, thanks. And I think I was just going to say, it's also a testament to yourself and others who educate in a very accessible and neutral way. And as far as it isn't, you know, thou must do, it's a case of listen to this, look at what we've learned here, look at what we've learned here, and then inviting others to put those bits of the jigsaw together that's relevant for them, especially for caregivers. I think caregivers, I find, are actually the best at this, because when we support that awareness, they know their animals really well, actually. Yeah. And some of the more traditional views of dogs specifically is actually a barrier for them, because they kind of instinctively kind of know stuff. And I think it's just unlocking that sometimes, and allowing that process to unfold. Well, a big thank you, Amber, for tonight, and I really appreciate your time. And I know it's going to have been a great conversation for many people, and I'm really excited to see what you're going to be doing next year. And as I say, there's so many voices coming together now. I think we're all happy to collaborate more. I think collaboration is a relatively new thing in my community for sure, but we're recognizing the power in that, and coming together and doing joint events and finding ways that we can maximize the base for the message that we're trying to put out. I think it's really important. Well, thank you very much. Just a quickie, everybody. Sarah Fisher's here next Saturday, 4 o'clock UK time. Also an announcement. I've got an announcement to make as well on that live. So Sarah's coming next week. Thank you so much, Amber. Really appreciate your time tonight. And yeah, thank you everybody who's tuned in.
Yeah, thank you for listening. Thank you for having me. It's been great.
Thank you.